It's now my pleasure to introduce Tim Campbell from the School of Rural Health to tell you about the further psychological impacts of the event. Over to you, Tim.
Yeah, thanks, Michael. And it's good to be here to present today on the work that we've been doing in the psychological impact stream. So last year has been a busy and productive time in the stream, with a number of research works progressing and some important findings also coming out of that work. And this includes the completion of an analysis of 10 years of NAPLAN results that span from before to after the mine fire, and then comparing schools in Morwell with those across the wider Gippsland region. We've also had a PhD project that explores the impacts of the mine fire specifically on young adults in the local community, and that project is nearing submission. We've had a collaboration with the Hazelwood research stream, which investigated administrative reports, again scanning before, during, and after mine fire, of ambulance attendances, emergency department presentations, and hospitalisations for mental health concerns specifically. And we've been working on a number of analyses stemming from the follow-up survey we conducted early last year with people who previously participated in the adult survey in 2016. And these analyses are focused on not only the trajectory of mental health and well-being in the community after the mine fire, but also on understanding how other factors, for instance, social supports and sense of community, might influence people's vulnerability to experiencing longer term or persistent distress in relation to the mine fire. So considering the work in a bit more detail, a number of important findings in relation to mental health outcomes for adults exposed to mine fire smoke have recently been released. The key finding that comes out of our Hazelwood study is that during the mine fire, where PM2.5 levels were higher, the volume of people who sought the assistance of an ambulance or hospital for a mental health concern was also higher. Specifically, what the data showed was that with each 10 microgram escalation in PM2.5 concentration, ambulance call-outs for anxiety subsequently increased by about 38% over the next 5 days. And similarly, hospital emergency department presentations for depression increased by about 36% in that same time frame. In Morwell, during the mine fire period, mental health related ambulance attendances and emergency department presentations were almost double the average rate observed across the same time period in the years both before the mine fire and after it. And in conclusion, they're considerable effects, and they demonstrate the importance of services being suitably prepared to meet the mental health needs that arise in response to events like Hazelwood. The first set of results coming out of the 2019-2020 Mental Health and Wellbeing Follow-up Survey indicate that distress associated with exposure to smoke during the mine fire was still evident some 6 years later. And many of the mental health impacts that we first observed in the adult survey remained apparent, such as that people who were exposed to higher levels of PM2.5 typically experienced the higher levels of distress in relation to the event, and that younger adults appear to have been more susceptible to experiencing distress. What we also found in this study was that overall psychological distress associated with the mine fire in 2014 was higher in 2020 than when we previously measured it in 2016. So we think here that it's important to consider this finding in the context in which the follow-up survey took place. So the data collection period happened to overlap with the occurrence of the Black Summer bushfires and periods of time where many of you will recall our local region was again subjected to some smoke haze. And so accordingly, those background circumstances could reasonably be anticipated to have perhaps triggered or exacerbated distress associated with the earlier mine fire in at least some people, and that may largely account for that upward change in distress that we observed. But nevertheless, it's an interesting finding because it perhaps reveals a sensitivity that now exists in the community. As I previously mentioned, the Psych Impact Stream has also recently completed a longitudinal analysis of NAPLAN results to examine how the mine fire may have affected educational outcomes in local primary and secondary schools. And so to do that, we compared the NAPLAN performance of Morwell schools between 2008 and 2018 with schools from the rest of the Latrobe Valley that were less exposed to the mine fire, and also with schools from the nearby Wellington Shire, and to identify a deviation in the trend of results associated with that exposure to mine fire smoke. And so with this method, we were able to estimate that the interruptions to schooling associated with the mine fire amounted to about a 4 to 5 month delay in academic attainment among students attending Morwell schools. And that was evident in that next round of NAPLAN testing in 2015. That delay presented similarly in each of the 5 academic domains that make up NAPLAN. And as you may notice if you've followed that dark red line on the graph presented here, the delay in academic attainment that occurred after the mine fire has been gradually recovered over time. However, as you can see there in 2018, some 4 years later, that catching up was incomplete. And what we also noticed in our findings was the spelling domain stood out from amongst the academic domains as an area where that recovery wasn't happening as well as in those other domains. So accordingly, these findings, they emphasise that there's a need for targeted educational support during and following disruptive events, again, like Hazelwood. So moving on, our research plans for the next year include completing further analyses of that mental health and wellbeing follow-up survey data to investigate factors that may underlie why distress had increased at that time point for some participants and decreased for others. So looking at vulnerability factors and also protective factors. We're also going to utilise that data collected in the survey in collaboration with the community wellbeing stream to explore the intersections between individual level wellbeing and community level wellbeing. We also have plans to complete further rounds of data collection in 2022. And as mentioned earlier by Faye, in early 2022, we will be conducting a survey of families who participate in the early life follow-up. And that survey is designed to explore the mental health and wellbeing of parents and families, and also the association of parental mental health and family wellbeing with the health and development of the youngest children exposed to the mine fire event.